Hi, I'm Dr. Nick Campitelli. Thanks for stopping by my YouTube channel. In today's video, we're going to be discussing athlete's foot infections. We're going to talk about what an athlete's foot infection is, what are some things you can do at home to help treat it, and most importantly, when it's time to call your doctor to make an appointment. So let's get started. So what is an athlete's foot infection? An athlete's foot infection is a fungal infection that occurs on your feet, and there are several different ways this can happen. You can get an infection that causes dry, scaly skin around the soles of your foot, and we call it a moccasin-like distribution. This is a classic sign of an athlete's foot infection when it occurs on the soles of your foot, and you'll see redness, dryness, flaking, itching, and burning around the sole of your foot, and it occurs in that moccasin-like distribution that we refer to. You can get a second type that occurs in between the toes, and the classic sign for this is when you see that whitish macerated tissue. You know, like if you were in the bathtub too long or you were in the swimming pool for a long time, your skin gets that pruny appearance. That's called macerated tissue. And when this happens in between the toes, we start to worry about it being a fungal infection, because fungal infections occur in warm, dark, moist environment, which are our feet. So why do they call it an athlete's foot infection? Athletes tend to sweat a lot, which causes that wet, moist environment in our shoes. We put our feet into dark shoes, our socks are on our feet, it encloses them in that warm, dark, moist environment, which allows the fungus to grow. So that's why it's called an athlete's foot infection. The medical term for an athlete's foot infection is tinea pedis. Tinea, which refers to fungus, and pedis refers to your foot. So what are some things you can do at home to help treat this? Well, the first thing that you want to do is to control that warm, dark, moist environment. So let your shoes dry out. You should never put them in the closet. When they go in the closet, they stay dark, and that likes to harbor fungus. Change your socks frequently so that we can contain that moist environment, get rid of the wet socks, or just leave your feet without socks. And most importantly, you want to dry really well in between your toes so that you can stop that macerated tissue from occurring that we talked about before, and that harbors the fungus. And finally, some simple tricks are putting cornstarch and baking soda in your socks daily and in your shoes. I usually say weekly or a couple times a week, and that helps to control that moist environment. You can try buying an over-the-counter antifungal such as Lamisil, or the generic name for that is terbinafine, and you can use that twice a day for several weeks to see if that helps your fungal infection. Some of the myths that you might have heard about is soaking your feet in warm water and Epsom salts. While this may help with other conditions such as ingrown toenails, this really won't help a fungal infection. So when is it time to call the doctor? This is the most important part of this video. If you ignore an athlete's foot infection, especially the kind that occurs between your toes, you can get cracks in the skin, which opens the skin up to bacteria, and that bacteria can get in and create an infection in your skin, and this can be severe. I've had patients, and this happens many times, that are admitted to the hospital because of an athlete's foot infection where the bacteria creeps in between the toes and creates what we call a cellulitis. And these patients are hospitalized, and in patients that have immunocompromisation or their immune system isn't working well, they can get severe infections which can lead to an abscess in the foot. And there's been even times where I've had to amputate toes because patients have ignored this infection, resulting in hospitalizations. So to review, the most important things to look for are the wet, macerated web spaces between your toes. We want to keep those nice and dry. If you have any cracks on your skin, make sure you're calling your doctor to get an appointment because you could have a fungus infection that's becoming severe. Thanks for watching. Remember, please hit the like and subscribe button to see more videos coming in the future. And if you have any questions or comments, please leave them in the comments section below.